Welcome everyone to Camaraderie Health Agency webinar. Essential tips for navigating Medicare like a pro. That big 65th birthday is on the horizon. So, let me ask you a question. Does the word Medicare make your stomach do a little flip? If it does, you're in good company. Honestly, it can feel like trying to solve a puzzle in a language you don't speak, full of weird terms, deadlines that scream, "Don't miss me," and choices that feel way too permanent. The biggest fear? Making one wrong move that costs you for life, either with penalties or gaps in your healthcare. If you're nodding along, just take a deep breath. My name is Ben Washington, and I'm a licensed insurance broker. I've helped hundreds of people who are sitting exactly where you are now. My goal for this video is simple: to hand you a clear, easy-to-follow roadmap. We're going to slice through the confusion, translate the jargon, and give you the essential tips you need to handle this like a pro and enroll with 100% confidence. Alright, let's start by tackling the biggest headache for most people: the alphabet soup of parts A, B, C, and D. It sounds way more complicated than it actually is. First up, you have Original Medicare. This is the government-run foundation, and it comes in two pieces. Part A is your hospital insurance. Think of it as covering your room and board if you're admitted to a hospital or for a brief stay in a skilled nursing facility right after. The good news? For most people who've worked and paid Medicare taxes for about 10 years, Part A is premium-free. Part B is your medical insurance. This covers basically everything else: doctor's appointments, outpatient procedures, lab work, preventative care, you name it. Unlike Part A, Part B has a monthly premium. For 2025, the standard monthly premium for Part B is $185. Together, A and B are Original Medicare. Simple enough, right? The other letters, C and D, are all about your choices. Part D is for your prescriptions. Original Medicare has a blind spot. It doesn't cover the medications you pick up at the pharmacy. If you need drug coverage, and most people do, you'll need to enroll in a separate Part D plan from a private insurance company. Part C is better known as Medicare Advantage. Now, this isn't an add-on piece. It's an alternative to Original Medicare. These are all-in-one plans from private insurance companies that bundle Parts A, B, and usually D, all under one roof. Here's a simple way to think about it. Original Medicare, and B, is your basic cable package. It's got all the essential channels. A Part D plan is like adding on HBO. A Medicare Advantage plan, Part C, is like switching to a different provider that offers an all-inclusive bundle deal, basic channels, HBO, and maybe some free streaming services, but you have to use their equipment. We'll get deeper into that choice in a minute. Now that we know the players, let's talk about the game clock. When it comes to Medicare, timing isn't just important, it's everything. Missing your enrollment window is one of the easiest and most punishing mistakes you can make. Your main window is your initial enrollment period, or IEP. This is a personal, 7-month window that starts 3 months before your 65th birthday month, includes your birthday month, and ends 3 months after. Signing up during these 7 months is mission critical. Why? Because if you miss it and don't have other qualifying health insurance, you can get hit with late enrollment penalties. And these aren't just one-time oops fees. They're lifetime penalties that get tacked onto your monthly Part B and Part D premiums forever. For Part B, that's a 10% penalty for every full year you could have had it but didn't. It's a financial hangover that can haunt your entire retirement. If you're still working past 65 and have health coverage from that job, or your spouse's, you can likely delay signing up for Medicare without a penalty. This is called a Special Enrollment Period, SEP. When you finally retire or lose that coverage, you'll get a special window to enroll, penalty-free. Your first 2 critical decisions. Okay, you know when to enroll. Now you face 2 big decisions that will define your healthcare journey. Decision number 1. Do I really need Part B right away? Since Part B comes with that monthly price tag, it's fair to ask if you need it right at 65. The answer is surprisingly simple. If you don't have creditable health coverage from a current employer, then yes, you absolutely need to sign up for Part B. And that's the key: coverage from a current employer. COBRA or a retiree plan from a former job do not count. If you're turning 65 and your only other option is COBRA, you need to drop it and get on Medicare to dodge that lifelong Part B penalty. However, if you're still working and love your company's insurance, you might be able to put off Part B. You'll just want to compare the costs and coverage of your work plan to Medicare. When in doubt, though, signing up for Part B is the safest bet. Decision number 2. The big fork in the road: Original Medicare or Medicare Advantage. This is it, the biggest choice you'll make. You have two very different paths for your healthcare. Path 1 is Original Medicare. This is the government's Part A and Part B. The number one reason people choose this path is freedom. With Original Medicare, you can go to any doctor or hospital in the US that accepts Medicare. No networks, no referrals needed to see a specialist. That flexibility is its superpower. But it has a big catch. Original Medicare only covers about 80% of your outpatient costs. You're on the hook for the other 20%, and there's no limit on how high that 20% can climb in a year. To plug that hole, most people on this path add two things. 1. A Medicare supplement plan, or Medigap. Sold by private companies, these plans help pay for that 20% gap, plus deductibles and other costs. 2. A standalone Part D prescription drug plan for your medications. So, this path is really a three-card system: your red, white, and blue Medicare card, your Medigap card, and your Part D card. It gives you incredible, predictable coverage and ultimate freedom, but it usually comes with a higher monthly price tag for that Medigap plan. Path 2 is a Medicare Advantage plan, Part C. This is that all-in-one bundled approach. These private plans have to cover, at a minimum, everything Original Medicare does. Their big draw? Most include drug coverage, Part D, and extras that Medicare doesn't touch, like dental, vision, hearing aids, and even gym memberships. The premiums are often shockingly low. Many plans have a $0 monthly premium, though you still have to pay your Part B premium to the government. So, what's the trade-off? The biggest one is networks. These plans work like the HMOs or PPOs you're likely used to. You have a list of doctors and hospitals you need to use to keep costs low. Instead of a higher monthly premium, you pay as you go with copays for services, up until you hit the plan's yearly out-of-pocket maximum. Neither path is better, it's about what's better for you. Do you value total freedom and are willing to pay more each month for it? Path 1 might be your answer. Or do you prefer low monthly premiums and love the convenience of an all-in-one plan with extra perks? Path 2 could be a perfect fit. You've learned the lingo, you know your deadline, and you've thought about your path. So, how do you actually do it? Thankfully, this part's pretty easy. Step 1. The best place to start is ssa.gov. Go there and create your secure, My Social Security, account. You'll need it to manage your benefits anyway, so it's smart to get it set up. Step 2. Apply for Medicare online at ssa.gov/Medicare. The application is fast, it usually takes less than 30 minutes. If you'd rather, you can also call Social Security to apply at 1-800-772-1213. Step 3. After you're approved for Parts A and B, you'll get your red, white, and blue Medicare card in the mail. Keep it in a safe place. Step 4. This step is crucial, so don't miss it. Enrolling at Social Security only gets you Original Medicare. If you decided you want a Part D drug plan or a Medicare Advantage plan, you have to take one more step and enroll in that plan directly with a private insurance company. Before we wrap, let me leave you with a few final tips that will save you a ton of headaches and money. Pro tip number 1. Don't set it and forget it. Your health needs change, and so do the plans. Every single fall, from October 15th to December 7th, is Medicare's annual enrollment period. This is your chance to change your mind, switch between Original Medicare and Medicare Advantage, or just pick a better drug or Advantage plan. Always give your coverage an annual checkup. Pro tip number 2. Check the drug list. If you take prescriptions, this is non-negotiable. Whether you're eyeing a Part D plan or an Advantage plan, you must look up that plan's formulary, its list of covered drugs. Make sure your meds are on it and that you know what they'll cost you. A new $2,000 yearly cap on drug costs kicks in for 2025, but it only helps if your drug is covered by your plan in the first place. Pro tip number 3. Triple check the network. If you go with Medicare Advantage, make sure your trusted doctors, favorite specialists, and go-to hospital are all in the plan's network before you sign up. Never, ever assume they are. I know this is a mountain of information. Making these choices is personal and can feel pretty high stakes. It's totally normal to have questions about how all this applies to your life. If you're feeling a bit stuck or just want a second pair of eyes on your plan, that's what we're here for. My team and I are independent brokers. That just means we don't work for any single insurance company, we work for you. We can help you compare all your options to find a plan that genuinely fits your health needs and your budget. If you want to schedule a no-cost, no-pressure chat with us, there's a link right down in the description below. And hey, if this guide helped you out, do me a favor and hit that subscribe button. We put out videos like this all the time to help you get the absolute most out of your Medicare. See, this whole Medicare thing doesn't have to be a source of stress. By understanding the parts, nailing your deadlines, and really thinking through your two main paths, you're already miles ahead of the game. Just remember the big things. Enroll on time, make a conscious choice between your two paths, and review that choice every year. You've got this. With this roadmap in hand, you are ready to tackle this process and enroll with total confidence. Thanks for watching. To learn more or go to www.camaraderiehealthagency.com.